and value really is that we should be taking our work beyond the hospital walls itself, and we should be involved in the community. We should be making an impact towards the improvement of healthcare for folks in our community. Homeless Health Initiative has been around now for over 30 years. We started because pediatric resident physicians in the emergency room were seeing a lot of kids from local homeless shelters show up pretty frequently in the emergency room, and they didn't quite understand why that was happening. And so they ended up doing an advocacy project, which had them go out to some of these local shelters, meet the shelter directors, meet families, and try to understand why they were using the emergency room so often. Pediatric residents, nurses, social workers, and other healthcare professionals actually go on site to several local shelters, primarily in the West Philadelphia area, and they provide medical care to kids that are there in the shelter. So they're taking away the need for families to have to come into the hospital per se, but their ultimate goal is to help families think about healthcare even while they're experiencing homelessness and living in a shelter, but also to help them build some trusted relationships with these large healthcare institutions, and specifically CHOP, and to understand the importance of healthcare and navigating healthcare systems. And so the goal is, when you take healthcare out to the shelters, to families, then you build these relationships and you help families then feel comfortable coming into the hospital. It's really pivot during the pandemic, try to meet the needs as best we could, but also reach out, do a lot of outreaches also, and go where we're being asked to come to really provide for, again, families that are experiencing homelessness or at risk. We've now expanded also to providing not just health, but health and wellness services. So some of those wellness services look like the provision of art therapy and art classes at one of our family shelters. You know, we recognize that all of these families and children are experiencing or have experienced trauma. And just the fact that they're experiencing homelessness itself is in fact a trauma. The thing really has been not just helping the families, but also helping so many healthcare professionals and social work students in training, people that have learned so much that are now going to go off and have gone off to really do more of this work and continue the work, you know, as the needs change.